Hospital Board Chairman, Dr. Wame Marabilala, Oceania Hospital Board members, Oceania Hospital CEO, Mr. Mugusen Pillay, and staff of the Oceania Hospital, those of us from the Ministry of Health that are here today, and the distinguished guests, members of the media. Good afternoon to you all. Dr. Wame said that, when you're getting old, when you're looking for your glasses, and I was laughing a little bit because yesterday my wife's aunties were at home. So they had a big banner program going, banner meaning to dye their hair. And so I used the leftover banner. If my hair is looking black and nice, I think it was a leftover from yesterday. It does work, right? It's a pleasure to be here for the official opening of the Oceania Hospital's new dialysis service facility. And for me personally, it's been a pleasure watching formerly Super Private, Main Health initially, Super Private, and then Oceania grow over the years and actually find a niche to which we can complement the work that's happening in the public service. I'm told that the hospital is embarking on a number of capital works projects as part of its hospital strategic plan. One of these, which we are opening today, is the new dialysis center. And I'm grateful that I could be asked to be here. Since last year's budget announcement, government has spent more than 1.4 million to cater for the cost of general outpatient services under the public-private partnership with general practitioners, as alluded to by Dr. Wame just recently. This program has seen Fijians who qualify for free general practitioner program, accessing a range of blood tests, multi-urine, dipstick tests, ECG, nebulizer treatment, oxygen supply, and ultrasound scan at no cost. And general practitioners will prescribe medicine and even provide the medicine to patients after hours if needed. In April this year, the list of free medicines has expanded to cover 140 items, comprising 136 medicinal products and 4 consumable items, mainly wood dressing materials. Government has also taken a two-pronged approach to ensuring affordable and equitable access to dialysis treatment in Fiji. First, we increased the subsidy from $75 to $150 for dialysis for treatment for low-income patients. And second, we provided in private service providers under the kidney dialysis treatment subsidy program. The new dialysis services facility primary aim is to provide acute dialysis while at the same time carrying out chronic dialysis here at Oceania Hospital. And I've heard that it's over $180,000 worth of other equipment and consumables. I'm also told that, as alluded to by Dr. Wame, that the new birthing unit will be complete by the month's end, and the MRI facility, which is under construction, expected to open at the end of the year. Having Oceania Hospital partner with the government with the GP scheme and also complementing other services will ensure that all Fijians have access to good medical care. At this juncture, I would like to thank the Oceania Hospital, the largest private hospital in Fiji, and the South Pacific for their collaboration in complementing the current medical services we offer. With these sort of investments, Oceania Hospital during these challenging times, Fijians will have access to the high standards of clinical expertise and medical care and ensure that we are leaving no one behind. I'd like to finish by saying that it is also wonderful to be here today to see familiar faces that have been part and part not only of my growth but the growth of many other doctors and health professionals all throughout Fiji. It's also good to see some familiar faces that at one stage had left Oceania, now back here at Oceania, such as Mr. Gubugutia. And I'm really glad that we can all come and enjoy today's events and actually meet as familiar friends and colleagues with the whole purpose of just working together to ensure that every Fijian has access to good health care and ensuring also that our children have access to treatment that will allow them to have a better future. Navalu.